The ovarian veins are part of the important system for draining the pelvis, draining the blood out of the pelvis, and are usually the left ovarian vein is the vein that's most highly associated with pelvic congestion syndrome, which is more common than this. The veins, the ovarian veins, there's one big one on each side, but each ovary is surrounded by this little plexus of veins that then, becomes one vein on each side and travels with the arteries as always, and up the side of the uterus along the psoas muscle until finally on the left side, the left ovarian vein is going to insert into the left renal vein, and the right ovarian vein will insert into the abdominal vena cava. So you can see here, where's my little arrow? There it is. All right, so this is the ovary, and here this kind of like tan is the ureter going up to from the kidney down to the bladder. And then the blue is always going to be vein and red is artery. So you got the left ovarian vein traveling with the artery and coming up to the left renal vein, and the right ovarian vein and artery coming up, and the right ovarian vein inserting into the vena cava. And you can see that's at an acute angle on the right, and on the left is 90 degrees, so it's pretty open there. So ovarian vein syndrome happens when there's a varicose and dilated ovarian vein that compresses the ureter, because you can see that on both sides, the ovarian vein and artery cross over the ureter. This happens somewhere between lumbar spine number 3, 4, and 5, somewhere in there typically. The diagnostics that they use for ovarian vein syndrome can either be abdominal and transvaginal ultrasound, so either ultrasound through the stomach, the abdomen, or through the vagina. Intravenous urography is when they inject a dye into your vein and then watch that dye go out through the kidneys, the ureter, the bladder, and see if there's any kinks in that system. Retrograde pylography is kind of like the opposite of that. That's where they inject dye into the urethra and they watch it go up through the bladder, the ureter, into the kidney with the x-ray. And then it used to be that percutaneous ovarian venography was the gold standard. I really don't think this is anymore. The articles are all old. And so I doubt if this is something that's really used very much anymore. But that was when they they injected dye and they watched it go through the ovarian vein to see if there was any dilation or any issues with the vein. And then, of course, there's also magnetic resonance venography, where they would use magnetic resonance to look at the veins with contrast. The biomedical treatment is to use drugs to cause venous contraction and to work with the hormones to try to optimize flow. They can also embolize or cut off the circulation, put a little clot or something in the vein to stop it from being functional, so that then you'd have the other side picking up the slack. Or else you can do a laparoscopic surgery of the belly to see what's going on and find it and fix it type of deal. So in conservative medicine, which is what I practice with functional medicine and manual hands-on therapy, What I would do would be listening with my hands to the viscera, the vascular system, the fascial system, and determining if there's constraint in that system, releasing that constraint through gentle manual therapy, or using things like castor oil packs to kind of like melt away adhesions, because adhesions can create a lot of perturbation in a system like this. And then also supporting the venous system and the urinary tract with herbs to help decrease the probability of infections in the urinary tract and improve the flow of blood in the venous system.